Hello, I am Karlene Lawrence, Doctor of Nursing Practice and an adult nurse practitioner. I'm also co-director, clinical coordinator of the Bridge Interprofessional Team and a clinical assistant professor in the College of Nursing here at SUNY Downstate. Today I'm presenting older adults, healthy aging, preventive health evaluations, screening, vaccines, and testing. This presentation is funded by one of the grants on our service, Geriatric Psychiatry Service. It's the HRSA grant, which is to educate the next generation of healthcare providers to be age-friendly and dementia-friendly. I don't have any conflicts of interest, financial or otherwise, to declare. These are some of the acronyms that we use throughout our presentations, and if I am using one of these, I will explain it at that time. Our grant is based, and on our service, our clinical evaluations of our older adults on our service is based on the 4M's framework. What matters, which is not the chief complaint. We actually ask our patients and caregivers what matters to them. Medication reconciliation to decrease polypharmacy and any incidences of adverse reactions from medications not being taken correctly. Mentation, we are geriatric psychiatry, so we screen our patients at every visit and compare one visit to the last. And also mobility, we assess their functioning, their ability to independently care for themselves, and hopefully assist them to stay in place, aging in place in their residencies for as long as possible without the need to be admitted to a skilled nursing facility. This grant is a collaboration between the John A. Hartford Foundation, the Institute of Healthcare Administration, and the Catholic Health Services of New York. This presentation, or self-learning module, is one of the topics in our learning module group E. As you can see, older adults, healthy aging, and preventive health. The learning objective for this presentation is to, one, identify the multi-dimensional factors of wellness, name at least 3 age-friendly healthcare initiative interventions, discuss the impact of integrating the 8 dimensions of wellness in older adults' healthcare plans and goals, and recall at least 5 recommended adult vaccines or boosters for older adults. What is wellness? Wellness includes the following multidimensional factors of life that affects overall health, and not only for older adults, for all persons. Your physical health, your intellectual and mental health, emotional, spiritual, social, financial, and occupational and environmental health. The wellness wheel on the left actually expands on what each of these topics entails. So overall health is not just your physical health, it's not only your mental health, because we are geriatric psychiatry, it's the overall well-being of an individual that affects your actual health, physical health, but also your health, which includes your families, caregivers, friends, relatives, and your interaction with them, and also your interaction with your environment and where you live. Preventive health and wellness exam includes assessment of sleep hygiene, how well you're sleeping or not sleeping, your mental health, any diagnoses of mental disorders, life stressors that you may be experiencing in your relations, sexual health, sexual transmitted, if you have any infections in your sexual health, in your sexual life, employment and finances, your family dynamics. Are you head of the household? Are you the grandparent caring for your grandchildren? Are you a sandwich generation between your aging parents and your children? Domestic abuse and violence, neglect, emotional, verbal, or physical. Eating disorders, which includes anorexia, bulimia, or abuse of laxatives, cigarette or alcohol and substance use or abuse, legal or illicit substances, your support or coping system, who's there for you when you need to speak to someone, or if someone is there to pick you up when you're feeling down. So does that include family, relatives, friends? If not, then is there a teacher, clergy, or someone else that you rely on or is there for you? And need for counseling and referrals as indicated. So this is what a preventive health exam includes. And not only these topics, but these are the main topics. So first we'll start with the general physical health. So adults 21 to 65 years are recommended to have a screening exam every 1 to 2 years. And most insurance companies will pay for this exam every 1 to 2 years, which includes a check of your vitals, which includes a blood pressure, your weight, your height, and between the weight and height, we calculate what's called your body mass index, and a physical exam. Blood tests, including urinalysis. So this presentation, again, is about older adults, but I'm also mentioning what others that may be viewing this video are also requested or advised to have for their daily wellness. So adults aged 50 to 65 years are recommended to have a general physical exam, health exam every year, so annually. And including all the topics that were listed above, the blood pressure, the weight, the height, your body mass index, your physical exam, whatever blood tests or urine tests that may be indicated. It also includes screening for cholesterol, for lipids or cholesterol, your high density cholesterol, your low density cholesterol, and the ratio between that, and discussing the effects of having high levels of cholesterol, what the risks are for your health and well-being. And adults aged 20 and older are recommended to have a general health physical exam every 2 to 3 years.